work without you making more for us.
That's right, says ambulance!
Can you just chill out, please? We're not going to get there any quicker.
We've got priority, pal! What?
Please be advised that smoking is not permitted in the approaching except in designated areas.
Due to strong winds, passengers are advised that some flights are experiencing delays at this time. We apologise for any inconvenience to our passengers.
Hey, it's me. I made it after all having arrivals, and I can't wait.
Passengers are advised to keep their luggage with them at all times. Any bags left unattended will be removed without warning by security personnel.
I don't care what you're doing. I need some help here. What happens about my case?
I'm sorry, this gentleman's just before you. Excuse me.
Oh, that's brilliant. Thanks a bleeding bunch.
Excuse me. I just left that seat for a sec.
And?
I'm pregnant.
It's not an illness, you know.
Would you like mine?
No, but thank you.
Thanks, mate. I wonder what we're going to get coming off the plane, eh? One of the big ones? Heart attack, stroke, DVT.
You sound almost hopeful. Are we not wishing something bad on this poor woman, Geoffrey?
Well, after all the drunks we've had to deal with recently, it'd be nice to actually attend, wouldn't it? Try and save someone. It's nice to feel needed, isn't it?
I don't know why you've arranged this. I'm perfectly capable of getting up and walking. I don't want to be checked out.
Right, so some Jefferson's Dixie. You want to fill us in?
She was taken ill on the plane.
I'm fine!
Mum, please, you're in a right state up there. She never flies. She's got a complete phobia about it. She couldn't breathe.
Let's check you over then.
How are your calves feeling? Are they painful at all or tender? It's just shortness of breath can be a symptom of DVT.
My legs are fine. And you'd have panicked too if you'd been stuck in that tin coffin for the last 8 hours.
Okay. Well, let's get you to the ambulance and get you in and make sure everything's okay.
Has your mum got a history of heart problems or stroke at all, do you know?
How would I know? I haven't seen her for 25 years.
And hasn't this been the perfect reunion?
Right. Thank you.
Thomas Little, that's the lot of Adam's patients.
There's absolutely nothing on Matthew Haddon.
That's everything we have.
All right.
This is ridiculous. In the States, you don't call an ambulance until a limb drops off.
Why do you think I wanted you to come back home?
Okay, this way.
Come on, my phone gets worse jet lag than I do. I'm just calling Lexi.
Oh?
Lexi, my girlfriend. I've only been talking about her for the past 8 hours. Great, she's stuck in traffic.
Well, you're the one I came here to visit.
Passengers are advised to keep their luggage with them at all times. Any bags left unattended will be removed without warning by security personnel.
I just don't understand, why do you have to be like this? Lexi's part of my life now.
I know that. Girlfriends come and go. Give it a year, you'll be the one saying Lexi who.
All right, do you think we could save this for later, please?
I don't think so, Mum. Lexi's pregnant. That's why I wanted you to come here. You're going to be a grandmother.
Jeff!
You looking for this?
As a matter of fact, yes, I am. Anaphylaxis. No way. No way, Adam. You falsified these notes.
Something we need to talk about.
Yes, in my office now.
Holby City ED.
Yeah. Okay, will do. Thank you. Explosion at the airport. Can you get everyone in, please, Tess? We've got a mass casualty incident.
I'm fine, you don't need to walk me anywhere.
Well, give me a number, then.
I've just got a new number and I haven't learned it yet. I haven't got my phone with me. I'll see ya. Weird. Thought I didn't. Hello? What? What day is it? Well, I can't be late because I'm not meant to be in today. What do you mean, an MCI? Right. Okay. Sorry, mate, gonna have to love you and leave you.
What happened? I don't understand.
Flying glass, mate. It's cut clean through his scalp. It may have got an artery as well.
Turn this thing around. You should be helping those people back there. Let me out!
Whoa. Calm down, calm down, calm down. Now listen, I need to get you to hospital sharpish, all right? Believe me. Now, my partner's with him. I'm going to drop you off and I'm straight back out there, okay? Just need to stay calm.
Come on, pick up.
Hi, this is me. Leave a message.
Lexi, stop wherever you are. There's been some kind of explosion at the airport. Anything could happen.
Whoa. Calm, nice and calm. That's the way, that's the way.
I'll try her again.
Can you hear me? Can you tell me your name, mate? Mike. Okay, mate. Sorry, yeah, sweetheart. Good man. Be nice and still for me, okay? Good lad.
Okay, Dixie is our AIO, so she is your point of liaison with the ambulance service. There's a mobile medical team en route to the site. Armband.
Armband?
The MMT have asked for one MCI-trained nurse and one doctor for site triage. Do I have any volunteers?
Count me in.
I'll go.
I don't think that's appropriate.
Well, I'm gonna have to borrow
Not
some.
because of the heels. You're the clinical nurse manager.
You're running the MCI from here with me. Understood?
I'll do it.
I've just done my MCI training, so I'll go.
Yeah, me too.
No, Dr. Lyons, I need you here. Clear the ED with the nurses and then go to resus. Zoe, take over CDU for non-life-threatening urgencies and set up the high-dependency cubicle for a resus overspill. Cubicles will be our walking wounded clinic and greens only in there. Thank you. Big man, action cards at the ready and MCI patient numbers. Thank you very much as they arrive.
I'll get the triage point set up at the main entrance.
Excellent. Linda, have you sealed the other entrances?
Well, I've only just got here. What for?
Don't want any Mr. JM on it.
Clinical nurse manager Andrews, maybe you'd like to allocate some jobs to your team? Adam, about our conversation. I need you in recess today.
I'm all yours.
You better be. I'm watching you. Okay.
Driving, mate.
Jeff, did you hear this hospital is MCI only?
They are MCI. Just outside the blast zone.
How's it look over there? Come on.
I have to get into my kit.
Let's go.
CC
CCTV images show the moment of total chaos when the explosion really hit. This is somewhere one would normally associate with happiness, people being reunited after
Someone turn the sound off,
happy holiday.
Diane Collins, 65 years old. She's been scalped by a flying glass. It may have nicked an artery. GCS was 15. BP's 110 systolic. She's had 10 of morphine.
Right, who's this?
This is her son, Greg. He's got an open laceration on his right arm, code green. Thank you.
Thank you, Jeff.
We treated Diane for breathlessness. She experienced on the flight.
I've got this, Nick.
Hello? Greg, is it? Mate, do you want to come through to cubicles and I'll check your injuries? Thank you, mate. Listen, I know it's been a bit of a shock, but cubicles just through there. Come on, buddy, come on.
Hey, it's me. I made it after all. I'm in arrivals. And I can't wait.
It's over here.
His legs are trapped, the blood supply being cut off.
Just too bright, Meg, but yeah. We might need to amputate. Pulse is 110. BP's 100 over 80. No pedal pull.
Okay, let's get some morphine set up. Can we get rid of all this debris, please? I need you to stay awake for me, okay?
Matt? Matt? Can you stick with us, darling? We're going to need you over here.
Just 1 second, I just need to...
It's you. But you've got to keep it together. If he's too far gone, you don't label him red. You know the drill. Blue for expectant. If he isn't going to make it, you're going to have to leave him. Just focus on the ones who might.
When you're ready. Thank you.
Okay, there's quite a lot of blood loss here. Francis, can we get the big sutures ready,
Where's
please?
my son? He was here before. He just vanished.
I'm sure he's around somewhere, Diane. That's the artery tied off. Can I get the saline syringes, please? Thank you. This is going to feel a little odd, Diane, but I can't start suturing until the wound is absolutely clean.
You really don't need to bother about
Steady on.
me.
Yes, I do. Trust me, or some holiday you're going to have. Can I have the other one, please? So whereabouts are you from?
Here. Born and bred about 10 miles away.
Really? But you lived in the States for, what, 10 or 15 years, I'm guessing? You don't pick up that accent overnight. All right, ready for the sutures now.
Adam, another one for you.
Number 4, thanks.
Unconscious. Serious head and hand injury with 3 fingers blown off. GCS 8. Pulse 175.
Where's my son gone? I need my son.
Okay, I'll send someone to find him, Diane. Francis, can you keep the pressure on that for me, please? I'll be right back.
This one's a priority. You get us straight to the ED.
What about me? I'm a priority and I'm sitting here like a lemon. Oh, I'm talking to you. We could be dying here.
I've yet to meet a dying woman who yabbers as much as you.
Why, if I got a green one and he's got a red one? I want a red one.
He has a pneumothorax. You just have verbal diarrhea. Capiche?
I need seeing. What about a yellow one then?
Wait. He's going off. Can we put him down, please?
Can you go and get a defib, please?
Matt, what are you doing?
Can I concentrate on your breathing?
Definitely straight through the recess, please. Thank you.
And hand that in.
Okay, Jeff, you're next.
All right, this is Bex.
Mac, what's going on out there?
They're reading through the press. It's taking them twice as long to get the patients out the ambulance in.
Does no one have any initiative round here? Carry on, sorry.
All right, thanks. Nasty laceration to the top part of the chest.
Thank you. I'm Linda Andrews, the emergency department senior nurse. I can answer your questions if you'll let me. mass casualty incident at Holby Airport arrivals terminal. We're seeing burns and blunt and penetrating trauma consistent with an explosion.
Is it a bomb?
All we know right now is that there's been an explosion. Police have yet to confirm the cause.
What about casualties?
There are upwards of 30 casualties that we know of, and we're still bringing more in.
Look, the truth is, I don't need this. I'll mend fine. Please stop.
Why?
I can't pay. And if you're thinking of getting the money out of my son doesn't care. He's got his own life now. Family on the way.
Excuse me, Doc. Sorry, my love. There's no sign of him. He's disappeared into thin air, I'm afraid.
So, he's dumped me here and he's run away. Well, you won't get a penny out of him now.
What are you talking about paying, Diane? How long have we been out of the UK? We still have the NHS.
But if you're an expat, that doesn't count, right?
Emergency care is still free. You don't have to pay.
So why did Greg go if he's not worried about paying?
Well, he must have his reasons. I mean, he flew you over here, didn't he?
Maybe he's just realizing what I worked out years ago. Families are more pain than they're worth.
So you've been back already, right? Have a think again about if you've seen my girlfriend. White dress, heavily pregnant. She's called Lexi.
Sorry, mate.
Well, maybe that's good news. If she was really bad, you'd have seen her, right? Because you take the worst hurt first.
Mostly.
What do you mean, mostly? I mean, surely it's common sense. The people who are really bad, who need the most help, you take them first. Unless...
My husband. Have you seen my husband? Our daughter got lost. He was looking for her. He came through here. His name's Ash. He's 39.
I'm sorry, I haven't been asking their ages.
You have to help me find Ash. He could be in danger.
Well, you wouldn't have anything to worry about if we were still in jail.
They couldn't hold an innocent man. But once I told them where he really was that night. Home. With me.
You lied for him? What are you even doing here? I thought Ash might be waiting for a fare, but all of you?
You have seen him. Wait, is he all right? You tell me he's all right.
You were making a run for it, weren't you?
Vivian, Joe.
1 second. He's supposed to be on bail.
Where is my husband?
He's badly hurt. He went into cardiac arrest.
Where is he now?
Heading towards Hobby City, ED. If you hurry, you might catch them. All right, gang. Is everyone happy? You should be a chair each. They're like gold dust right now, so don't think about blocking a seat with one of your bags.
Just getting the info through now.
Thank you. I'll be coming back in every hour with updates, or sooner if we get important news. Oh, and I've spoken to the charity that are doing the catering for the relatives. They should be along shortly with some free tea and coffee. Okay?
What about the allegation that a nurse assaulted a patient?
That's absolute nonsense. I can confidently say that no Holby City medic would ever hit a patient.
I don't care if you are an orthopod or a paediatrician or a magician. You do not come down to this department unless you're called for. Until then, you are just clutter.
Rubberneckers. Mr. Jordan. This way.
What are you saying? Come on, turn the sound up.
And then she hits him. Right there in the terminal. He's lying there completely defenceless. This Asian nurse, Indian, Pakistani, I don't know, just punched this poor man. The nurse...
Let's find out what's going on down there now, please.
The man was already pretty badly hurt. And then I saw her whack him.
That was Terry Carmichael, herself injured at the blast at Holby Airport, making some serious allegations.
Good luck to you, my friend. Hey, Jay, let's get this guy a cephalosporin and keep him nil by mouth.
So we found his next of kin?
No. If you've got time, let's find some ID. So far, he's patient number 22.
You guys seen the news? Some women out there making accusations saying that one of our staff has assaulted a patient at the scene.
OK, here we go. Reese Carmichael, No telephone number, though.
Him? Let's see that. Aye, that's the same surname as her out there.
And?
Well, and what's the bit in that that's her husband? She's out there mouthing off and we're in here trying to treat him.
Just want to find her then.
Come on in.
Right, thanks, guys. Bed number 2, let's get a sheet on it.
Lexi!
Jeff, over here.
Please, you have to help me. I'm looking for my girlfriend, Alexa Coulson. Please. Lexi! Lex. Please, help me. I'm looking for my girl. Lex.
She's calling you meant to be under observation.
I can still discharge myself, can't I? Medical care might be free here. It's not compulsory.
Go through that door and take
You
a
have
seat.
better things to do, trust me.
Linda!
Yeah. I've got to get to the bottom of these allegations. I'm swamped with this press stuff. Is there any chance you could take over?
You want me to run the MCI with Jordan? Take on your job?
Just for today.
Linda. What the hell is going on with the press?
Your guess is as good as mine.
Is someone doing something about it?
Yeah, I'm trying to. It can't be true. The only nurse out there fitting that description is Matt.
And there's no way she'd ever do anything like that.
Okay, this is Ash Murad, 39. He's got a blunt trauma to his chest. This could have been hit by flying glass. Cardiac arrest at scene. CPR given, 2 shocks. This is his wife, Rani, daughter, Annie. Both suffer from smoking electric.
Be treated too.
No, I'm fine.
What about Annie?
Adam.
Lamona, can you take him through to the walking wounded clinic, please? This way.
Turn him around, send him somewhere else.
What?
You cannot treat him.
Give me one good reason why not.
Adam.
Thank you. Sorry, just wait a second.
The whole reason for bringing her over here was to tell her together.
Well, I know, it just slipped out.
How does she react?
Well, I don't know. I've barely seen her since. Well, I was worried about you.
She'll be pleased, right? Surely she'll be pleased.
What, about being a grandmother? Yeah, of course.
You know what? I've helped you with stuff in the past. Can you just take my word for this, please?
Second line in, please, and bloods.
Let's get a full blood count. LFTs, use and ease, glucose and group and save. Lenny?
Adam, you okay?
Yeah, fine.
Yeah, this is a nasty break.
You want to tell me what the hell's going on?
Blood seems to have settled. Give him antibiotics and set up the femoral nerve block.
Dr. Lyons, you're going to talk to me. I'm going to ask you to leave resus. You want this guy out. Why? What's the history?
You don't need to know. Just trust me. You don't want to touch him.
Can we change this Donway for a Thomas Flint, please?
Right, let's get a chest drain set up, Jane, and give him some gel effusion, please. What possible reason do you
Put it
have?
this way, you've had some pretty strict criteria over who you will and won't treat recently, right?
Right, that is over now.
No matter what he's done.
What's he done, Lenny?
He's a rapist.
Yes, but there's 2 of you to think about now.
The X-ray was clear. They've checked my throat.
You were right in the blast zone. We put you under observation. Check on you from time to time. Well, where's the harm in that?
I just want to go home.
Well, you can't. At least not until I found my mum.
Am I all right to leave?
I'm pregnant. I'm not made of glass.
Excuse me, Diane Collin. She's my mum, American lady.
Oh, well, with the head injury?
That's her, yeah.
Yes, she left, I'm afraid.
I'm not letting you out of my sight.
I just need the loo. I can go on my own.
And not after what happened this morning. Look, you can't just go running off like that. You have me worried sick.
It's not my fault. I was following the man.
What man?
And then she hit him. Right there in the terminal. He's lying there completely defenceless. This Asian nurse, Indian, Pakistani, I don't know, just punched this poor man. The nurse.
Okay, let's get the pain relief in, please.
Did you hear what I said? Did you hear me? That is not me anymore. Judging people, I don't do that. Everybody gets treated the same. Now put the damn pain relief in.
Dr. Lyons, I trust you're giving Dr. Truman your full attention. Right, I'll need an internal fixation. Let's take him up, please.
Right, making the incision. Fifth intercostal space, anterior axillary line. Then you can have the chest drain, please. Okay, going in.
Even if it was Mads that he tried to rape. Right, Dr. Lyons, I think you should maybe deal with Mr. Carmichael from now on.
I don't see why I can't just radio Mads. This is important.
Well, so is the MCI. Radio frequencies need to be kept clear.
Well, I can hardly leave and go to the site. Oh, Dixie, I need to talk to you about Mads.
Sorry, I've got to get back to the scene. Is this about that nurse that hit someone?
Allegedly hit someone.
I don't understand. Why would anyone want to do that anyway?
Well, there's no imaginable reason why this nurse would hurt a patient.
Yes, there is.
Is your breathing all right?
You can't just ignore me.
My throat's just a bit tight.
Can I get some help over here, please?
There you are. Where did you think you were going?
Nowhere.
You know, I thought you might have changed. I thought this was going to be a fresh start.
Me too.
And I tell you about the baby and bang, you're gone.
That's not what...
What is your problem? Do you really hate kids that much?
I don't hate kids.
You hate me so much, you moved halfway across the world.
You loved your dad. You were happy with him. Like peas in a pod, you two.
Oh, so I don't need a mother? I pretended you were dead, you know that? That's what I told people for years.
I'm sorry.
And we thought we wanted you involved. You're the only grandparent this kid will have. Maybe it's better off without you.
Maybe it is.
Excuse me, Mr. Collin, your wife, girlfriend, is a bit of a problem. This your boyfriend?
Okay, we're going to have to intubate and need propofol and socks for the RSI.
I don't understand. What's happened?
My girlfriend suffered smoke inhalation during the explosion. She's having a bad reaction, her throat's swelling.
But she was fine.
We're going to anaesthetise her so we can get a breathing tube down her throat to do breathing
Apply
fluid.
cricoid pressure, then to count to 25.
Just a few minutes ago, she was okay. She's going to be fine, right?
The ring scope.
Please, Lexi, please don't leave us.
Are you all right?
I'm fine.
Yeah, we've been looking for you all over. If you haven't been so busy with the TV cameras.
Don't get it. What was he even doing there?
Well, we got the name from his wallet. Is it possible there were two Reese Carmichaels?
We split up like 2 months ago. We're supposed to go on his holiday together, but he'll be having it off with some stewardess. Some anorexic, permitan, blonde-tastic.
Is this his?
And you're saying head injuries?
And his hand. 3 fingers. They're hopeful the surgeons will be able to reattach them, though.
Well, whoever she is, he won't be much use to her like that now, will he?
Shall we? That's just over there.
Reese?
He's unconscious. We've got him intubated.
This isn't... It's not my Reese.
So, who the hell is this, then?
Well, I don't know.
Lenny, we need some help here. His vitals are dropped and his BP's
What are
hit
you
the
playing
floor.
at? Is this your idea of a joke?
Lenny, did you hear what I said?
Sorry about this. That's his way to reception, and...
doing anything about Madia? That woman said she hit my husband. I've told you why she did it. She is not safe to be practicing.
We're trying to save people's lives here. Matt's hit someone. There's accusations that Matt's hit Ashby Mad. It's not a joking matter.
She didn't hit him.
Excuse me.
It was a pre-cordial thump. Mads was restarting his heart.
I'll get the weight out.
Yeah, it's a good job she was there. She probably saved his life.
Mum! Mum! Linda, need you back in here.
You did the right thing calling me then.
Yeah, what, I don't know what's wrong with him. His systolics at 89. And...
I don't get it. His pale, he's clammy, his respi's at 30.
Ash, what have you done to him?
Adam, talk to me.
His tachy heart rate's 120.
You did everything right, Nick.
Minimal loss to the chest drain.
What's going on?
Mum, it's the man. The one I was following.
Not now, Annie.
That's why I ran off. He's the man who stole Dad's passport and stuff. He's a thief.
Can I get a wheelchair, please?
3 more incoming.
You hear me?
What's happening? I don't understand.
She's in cardiac arrest. We're trying to get her heart rhythm back to normal.
She's in fetal distress.
But the baby.
We're at Obs and Gynae. This isn't good enough. We need to get this baby out.
How long have we got?
Minutes.
Or what? Or what?
Right, no time. I'm making a decision. It's a good job she's out and intubated. Get me the resuscitator and the delivery pack. We're going to do this without her.
Lexi. Please.
Lexi.
Oh, it's not working. Pressure's in his boots.
His pulses are unequal. Must be more than trauma from the explosion.
Right, check that out.
What's that?
Nick, we've got a shard of glass 4, maybe 5 inches long. It must be from the explosion. The entry wound is tiny, but it's pierced the lung. The lung's collapsed.
Get on to cardiothoracics.
I tried to send someone up earlier. They've got 2 on the table. We've been sending them up all day.
She needs you.
Adam, you'll have to wait for them. I want to find out what's wrong with this man.
Well, that's fine. Let's swap. Cardiothoracics are
Adam.
your speciality. They're not mine. She needs operating on now.
Please.
That's still dropping, gents.
Come on, this patient is dying.
You don't trust me.
Given what I found out this morning, if this man dies, we are wide open to an investigation. And if they look into us, into you...
Yeah, I've made some big mistakes and I've let my colleagues down. But if we save these people, then it goes some small way towards redressing that pulse.
And what about Dr. Lyons? He's not exactly detached from this patient.
Lenny
is
is
he?
not going to make the same mistakes I did. He has his whole career in front of him.
If he dies, Adam, both of our careers are on the line.
I guess I better save him then.
Dr. Lyons, you're with me.
I can see the amniotic sac.
Cutting through.
It's a girl. Greg, you've got a little girl.
Why isn't she crying?
I'm cutting the cord. Get her into the resuscitator.
Why isn't she crying?
Linda.
I've got a heartbeat on Lexi.
OK, let's get her sutured.
OK, chest drain.
Anyone else spot this rash on the shins here?
Thank goodness.
OK, he's got spots on the palms. Let's have another look at that X-ray, please.
Still can't see anything, though.
The aortic knuckle, it's enlarged.
Talk to me.
He's got a double knuckle aorta. Everyone was worried about the penetrating trauma, but it's the blunt trauma that's the problem. The aneurysm was ready to blow, and the blunt trauma's caused it to leak. Right, OK, let's fast bleep the vascular team and try cardiothoracics again, please. Get me 8 units of cross-matched blood.
I don't understand that. How's he got an aneurysm? No. No, he's...
We won't know for sure without tests.
No, he tried...
I'll kill him.
No, don't go there!
In here we treat. That is all we do.
If Staff Nurse Durrani can get over it, so can you.
What?
The punch at the scene. It was a precordial thump. She was trying to save his life.
Hi, Lenny, are you with us? Okay, Jay, let's ease back on the fluids. Keep the systolic around about 100. I need a labetalol infusion, an arterial line, a catheter, and a VDRL test.
Light, please. Just extending the entry hole. Wow.
That's
Good.
fine.
Okay, please.
Is she going to be okay?
Baby needs to go up to the special care unit, but if you want to come and sit for a while with her, you can, okay?
You look after her.
We will. She'll be fine. Tess, I don't know how you did it today. It was like a military operation in here.
I didn't envy your dealings with the press.
Dealing with the press wasn't so bad. But the best thing about today was helping deliver that baby. Actually just being a nurse. Management, you can have it.
You say that now.
I mean it. All that shouting and planning and organising, it's not for me. I guess you saw that before I did.
Maybe it doesn't play to your strengths, but you were coping.
Coping, yeah. But inside I've been hating every minute. I'm handing in my notice as clinical nurse manager. As of today. So if you want the darn job, you're welcome to it.
Sure, this is my husband this time.
This time the patient is talking, yes? This is Rhys Carmichael. Mac, please tell me there's a stewardess in there with him.
Rhys, what are you doing here? Are you all right?
Fine, I came to meet you.
We only meant a plane so that they could get back together.
Never do that to me again. My nerves are shot. You want to surprise me next time? Tell me first.
Oh, some men are gluttons for punishment.
Sorry.
All I can say is, mate,
Oh, it should be like
rather him than me.
Any news?
Found this on the pickpocket's body.
It's not ours.
Yeah, I know. Just makes me wonder why he would have Ash's brother's passport. I mean, the police have his passport, right? Because he's on bail. I don't think they'd be too impressed if they think he was trying to leave the country.
He's a cabbie. He's entitled to be at the airport. It's his job. I've got no idea where the passport came from.
Why are you still lying for him? After all that he's done.
My husband. Nothing you can say will make me change my mind.
Mrs. Murad, may I have a word, please?
Syphilis?
I'm afraid so. It's been confirmed by the blood tests. He's pretty lucky that we caught it in time.
I don't understand. He can't have... It's not possible.
Well, he may have had it for a while. My concern, obviously, is with you. Have you experienced anything unusual? Any rashes anywhere or anything?
You think that I could have... Look, we're married. We're a couple. Neither of us have ever or would ever...
But the fact that your husband has syphilis, Mrs. Murad, means that, well, that one of you has contracted it from someone else.
You mean had sex with someone else?
Yes. Look, you may not be infected. Let's just do the tests, yeah? I shouldn't worry about your daughter just yet, not till we've seen your results anyway.
My daughter?
Yes, syphilis can be passed on mother to child, and since it appears that your husband may have been infected for some time... Yeah.
Heard about your precordial thump.
I know it's not in the guidelines anymore, but...
Did the trick, though?
We're headed back to base now. Anybody wants dropping off en route?
We're done here now, kid.
Remember that time when I went to the docks when Annie was born? I had the pressure on my heart. No, I did tell you. Blood pressure was a bit high. Remember that footballer that just conked out on the pitch? They found out he had a heart defect. No one saw it coming.
Just tell me, once and for all, Madia.
She's been getting to you again. I swear. I'm gonna make a complaint.
I just want to hear you say it.
On my life. On our daughter's life. I swear. I never touched her.
Or anyone else?
Of course, what are you talking about? Of course not on anyone else. What was that in aid of? When I'm going up to the surgery. You scared you're gonna lose me, huh?
I know I'm gonna lose you. I'm dropping your alibi, Ash. They told me why you have a heart problem. You have syphilis.
No, you didn't hear them right. They confused you with all that mumbo-jumbo.
Syphilis. Which you better pray very hard you didn't pass on to me and Annie.
What?
You swore on her life, remember? You better pray no one takes that literally.
Is the baby all right?
Yeah.
And Lexi?
She's still pretty ill, but they're doing everything they can for her. What about you?
About before, I didn't mean I didn't want a grandchild. I meant that I didn't want to be close to another baby I was only going to lose.
Lose? You didn't lose me, you walked away.
It was the best thing. Your dad and I fighting every day. You don't remember.
Yeah, I remember.
I thought if I wasn't happy, you wouldn't be. And I just wanted to give us both a chance to find a different life.
And did it work? Did it make you happy?
I just missed out on so much.
Allegations against a nurse at the scene have proved unfounded. Meanwhile, police and firefighters have confirmed that they're still speculating that the explosion was caused by workers drilling through gas piping. Sources at Holby City Hospital have confirmed that despite the widespread destruction of the arrivals terminal, there were no fatalities.
I was just thinking about you. When I first arrived, I didn't think we were going to get on.
Proof that first impressions are never wrong.
Do you know why that was?
Don't tell me we're two alike. Heroic, charismatic, good-looking. Somebody's got to give.
It was the jokes. Constant witty one-liners. I thought to myself, is this man ever 100% serious about anything?
Well, there's that.
Is that what I think it is? I don't have to accept your resignation.
No, you don't. You'd only have to fire me 5 minutes later. You've risked your job already once for me today, Nick. Don't make a habit of it.
You seen the news? We saved them. All of them. And I couldn't have done it without you, Adam.
Thank you for letting me have today.
Hey, shift's not over yet, you know.
No, the MCI is.
Murad's over too, by the way. I've got him under police guard.
Do you think he'll go down for the attempted rape?
Mm-hmm. And for trying to skip bail by fleeing the country on his brother's passport. He's not getting out this time. Which, of course, means that you are free.
Which means I'm free.
What does this? What does this mean?
It just means I don't have to wear my heart on my sleeve anymore. Not wearing the hijab doesn't mean I'm not a Muslim, you know.
Fair enough. Still can't believe you tried to help that guy. See if that was me.
Yeah. I bet you think I'm a mug, huh?
To be honest.
To be honest, yeah.
To be honest, it makes me love you that much more.
Okay, they're here, guys. Wait,
His
Oscar,
family conscious
out
with
the way.
GCS3 sinus rhythm include after chance.
Right, straight through, please.